Hello, everyone, and welcome. I am Cassidy Avila, and I serve as the Marketing and Communications Coordinator for the Texas A&M Rural and Community Health Institute. Thank you for joining us today for this panel presentation on chronic care management and remote patient monitoring in rural Texas. We will not be sharing slides today, so we have a panel presentation so that you won't see slides and we won't be able to share any with you. However, we will share the recording. If you give us a couple of days to get that out to you, we'll share the recording with you. And we're just going to jump right in today. I would like to introduce our panelist, Rayanne Davis, who is the Director of Value-Based Care at the Texas A&M Rural and Community Health Institute. And joining us from several rural hospitals across the state, we have Joey Nielsen, Chelsea Stroud, Brandy Kennedy, and Cynthia Martinez. And I think they're going to kind of let you know where they're from and tell you what positions they hold. So I will just go ahead and turn it over to you, Rayanne.
Great. Thank you, Cassidy. Thank you to all our panelists for sharing your time and expertise with us today. And thank you for everyone joining the conversation. We're excited to have representatives across several different rural health clinic organizations. And so they're going to bring a variety of experiences and perspectives to today's discussion. We're going to speak specifically and explore around chronic care management, which is a CCM. So if you hear that acronym, we're talking about chronic care management and remote patient monitoring, which that acronym is RPM. While these services have been available to rural health cares for several years, successfully implementing and sustaining them in rural communities comes both in unique opportunities and real challenges. Every organization has its own journey, and there is tremendous value in learning from one another. So my hope is that today's conversation provides insights, sparks new ideas, and encourages continued collaboration across rural healthcare. So by openly sharing what's working, what hasn't, and what lessons learned along the way, we can collectively strengthen our care delivery, improve patient outcomes, and continue to advance healthcare for the rural communities we serve. So to begin, I would just like to open it up to our panelists to share a little bit about your role and your organization. I'm going to start with Brandy, if you don't mind sharing your role and a little bit about your organization.
Yes, thank you, Ryan. My name is Brandy Kennedy, and I am the patient service coordinator, outpatient director at Limestone Medical Center, and most recently, population health. So we are a 20-bed critical access hospital with three rural health clinics and then a fourth clinic that is soon to be a rural health clinic. So um, I have kind of been the champion for the last 4 or 5 years to get chronic care management and remote patient monitoring instituted in our facilities. We are on year two, and first year did not go very well. So I definitely got some tips on what to avoid from our experience. This second year, we are with a new vendor and things are working out beautifully. The program is growing very quickly, and we're seeing a lot of great results from it. We're excited to be here today.
Fantastic. Thank you, Brandy. Cynthia, if you would like to go next and share a little bit about yourself.
Okay. I'm Cynthia Martinez, and we are here in Hereford, Texas. It's about 40 miles from Amarillo, Texas, just to give an idea, up in the Panhandle. Um, Small rural community, and we started about 2.5 years ago. I'm the CCM RPM coordinator here in our Medicare Wellness Department. Um, and I gotta say, it's kind of, I heard her say, the first year was kind of rough, and it was for us too, learning experience and all that, but it seems to be going really well now, and the patients are really getting the hang of it and who we are, and that, we're here for them, and it's exciting.
Fantastic. And then I will turn it over to Joey and Chelsea.
Hi, my name is Joey Nielsen, and I am the regional director over Anson, Haskell, and Stonewall rural health clinics, just kind of overseeing the CCM RPM programs there. And we just completed our first very rocky, rough year in trying to get this up and going in these rural clinics. And so I'm a little encouraged by the other speakers today that they also had a kind of rough first year because it can be discouraging. So I'm excited to input and also to learn from the other speakers today.
And I am Chelsea Stroud. I am a certified medical assistant and a community health worker. I am here at the Anson Clinic in Anson, Texas. And I am the CCM coordinator, chronic care manager at my clinic.
Well, thank you all so much, and I look forward to the discussions. I think y'all have put out some teasers there, so we're gonna dive a little deeper with those. I want to start with Brandy. A question for you. What prompted y'all to begin exploring chronic care management and remote patient monitoring?
So we had this all started with a physician champion. We had one of our physicians who was very interested in remote patient monitoring for his patients. And with that came exploration into the chronic care management because we just felt like it went hand in hand together. So after he had approached me for several years, wanting to get this ball rolling, started doing a little investigating, and we did recognize that our community, our patients in our rural area, they really struggled managing their healthcare in between office visits, and so there was a need for this. And so, there different social determinants of health, whether it was transportation barriers, limited access to specialty care, just gaps in follow up visits. We identified that this really would make an impact on preventable ER visits, if we could really get a great program going. And so we started engaging the other providers, discussing with them. They weren't as gung ho about it as our champion, but they were okay with it. They thought it was worth giving it a try. And honestly, that was before there was a lot of reimbursement. When we first started talking about this, the reimbursement model had just came out. So that also helped push us to go ahead and move forward where we weren't just going to be making huge investments with no way to get any return on it. So that's kind of how our journey started.
Yeah, that's great. And it's great to have a clinical champion to help move this
Yes.
along from the get-go. And I know every kind of chronic care management, remote patient monitoring structure can look a little differently. So I'd love for y'all to kind of describe what structure you have in place. So as the audience hears your lessons learned, your challenges, your what's working well, they can kind of get a concept of how you've structured your services. So I'm going to start with Joey and Chelsea first. They have a unique structure that is combining, as you might have heard, multiple different RHCs and organizations together. So, Joey and Chelsea, could you explain a little bit what your staffing looks like and how you've structured CCM and RPM?
Yes, I'll start. So I work remotely and am, kind of the nursing support to all three clinics. And then we have a chronic care manager in each clinic in person, there to be kind of the face of the program, introducing themselves to patients as they come in. And we also come together as a group and share ideas and share things that have worked and challenges that we've had. And um, kind of have that group approach, and we try to meet quarterly in person together and just go over things that we can improve on and new goals and successes that we've had.
And y'all are operating under the same technology platform. What does that look like?
Yes. Yes, that's correct. So each clinic has their own EMR individual program, but then for the chronic care management and RPM, we all operate in the same platform. And so I'm able to easily go between each clinic and review and oversee the programs in the same platform.
Fantastic. So you're the managerial oversight and you're helping all three different organizations, but they each have their own person on staff.
Correct.
And Chelsea, we heard from you. It sounds like you come from a CHW background, but those three people on the team, what are their credentials?
Sorry. So in Stonewall, we have Alicia, she's an LVN. And then in Haskell, we have Tabitha. She's not a licensed medical professional, but she's done training with Chelsea and with Alicia and with myself. And so just trying to get her going. One of the challenges in these small communities is actually just having the workforce, the people in the community, and people available for the clinics.
Great. And I think Chelsea, you had to come off mute and on mute. So Joey stepped in there. Thank you, Joey, so much. Chelsea, do you want to come off mute and just tell them maybe about how you got into this role?
Um, yeah, so I was externally hired. I have a background in as a medical assistant, as a care manager, and doing ER utilization, Medicaid. I have kind of an extensive background. So when I was, like I said, I was hired externally. So when I saw that this was opening, I was really excited to, do something for my own community that I lived in. And so it's been really nice to kind of go from doing something on a state level to doing something on a local level where I feel like I'm actually making a more tangible impact. I can see, what I'm doing, and I can see that I'm making a difference, and I'm able to grow relationships and meet the people that I'm talking to. And so that part is really nice. I am the only person that does this in our clinic, so trying to be everywhere all at once and get the community involvement and the clinic and staff involvement has been important.
Thank you so much for sharing. Cynthia, do you want to share how you all have structured your program and maybe how it's changed over the last years?
We have our Medicare Wellness Department where I oversee the CCM and RPM side of it, and then I have a nurse that helps me, Brittany. Um, but in the same department, we have some other ladies that do annual wellness visits, and we just kind of head on that, a lot of Medicare stuff. Um, Brittany and we do our best to get involved with the patient, meet the patients when they come in. And but what I like about us, and again, I'm sure that all of you that work in these small communities, small hospitals, small clinics, you know that you wear a lot of hats. So a lot of times I have the other ladies, Kaylee and Patty, that help also if we're not available or we're busy with something. And we just kind of become personable. Somebody said, getting into those relationships with the patient, and that's what I like is you make it personal with the patient, and they learn to trust you and they learn to confide in you, and I feel like that's been the thing that has helped us the most is we do that, and they know a face, and they know someone at the other end of the line. I can call her and ask her questions because I don't understand this, or I didn't understand what the doctor said to me in my last appointment, and so I like that they can trust us, and that trust is there. It's really helped a lot.
That's fantastic to hear. And so y'all's approach is more a care team based approach. You might have different responsibilities, but you're all working
Right.
together collaboratively.
Hmm.
And you're doing that CCM and RPM lift, but are you documenting your CCM and RPM within your EMR, or do you have technology also that you're bringing in to track your CCM efforts?
We have technology specifically for CCM and RPM. Mhm.
Okay, great.
Yeah.
Brandy, do you want to share a little bit about how y'all set up your CCM and RPM program?
Yes. Yeah. So, back at the beginning, we started with a vendor, and we have two separate EHRs. Two of our clinics are on one EHR, and one of them's on a separate. So we had to pay for two separate interfaces. There was two separate uh, well, I guess that there was one portal that the vendor was using. So the communication was not clear. What, the nurses were having to log into a portal. It just did not work. So when we went with a new vendor, we wanted them to actually document in our EHRs, our two EHRs. We wanted them to have live communication with our nurses and our providers, and it has worked beautifully. The collaboration has just been so much more streamlined. It's very integrated. There's great oversight. The care managers, they are, even though they are employed by our vendor, they represent themselves as Limestone Medical Center employees. Um, our patients know them by first name. It has just worked so well. Without this level of integration, I feel like we would have just continued to struggle. The whole integration and them scanning reports in. Nothing was ever really done in a timely manner or anything with that first vendor, just because I felt like there was a lag time. But everything being documented in real time, straight into our EHR, it's worked out so well. They're very involved. If we have a health fair, our vendor is out of state. It's in a southern state, but if we have a health fair, if we have anything on at the hospital, they participate. They did hire one local person here who helps for our RPM side of it. She meets with every single patient. She unboxes their equipment. She sets up the app on their smartphone. She goes through their first set of, is blood pressure, blood sugar. She walks them through that. They have her cell phone number. She is at each of our clinics once a week. And so they know what their patients know. Hey, she's going to be at FMC on Tuesday. She's going to be at Reddick. So they know where to find her. But also, that gives our patients a sense of her truly being a part of Limestone Medical Center. And that, that they don't even know what the vendor's name is because they really are a part of our team. And it's worked beautifully.
Well, thank you for sharing. That's a great example of bringing in resources that aren't employed directly by you all, but it sounds like there's challenges and you lessons learned there a lot and finding the right partner there. And that documentation with the EMR, I'm sure, is very important. Y'all all kind of already alluded to some of the lessons learned and barriers, but with every implementation, there's hurdles. If you wanted to expand a little bit more on what are the biggest challenges of getting the program off the ground and sharing with the audience of what that challenge was and how you overcome it or overcame it, that would be great to hear. And then before I open it up to the panelists again, if there's any participants on the call that would also like to put any questions in the chat, feel free to go ahead and do that. And we'll, if we have time at the end, go through those questions as well. So, Cynthia, would you like to share maybe one of your biggest challenges and how you've overcome it?
I think the biggest challenge that we had at the start was the patients, of course, they were not completely familiar with what CCM would do for them or RPM. And it really, again, it really helps as the year goes on. Everybody's mentioned how that first year is difficult. And wait till the second year and you'll see a difference. Um, and they start getting to understand that you are really going to call them, that you are really going to reach out, and they really can reach out to you, and that really helps to close that gap between you and the patient. And at first I felt like they would avoid me and ignore my calls, and now they don't. Oh, I saw your number and I answered right away. The biggest challenge right now, I guess, maybe it would be once in a while we run into a non-compliant patient, and but it's gotten a lot better, just a lot of teaching and explaining why it's important for them, and it's really helped. But that would probably be now the biggest challenge that we have, and I'm glad that it feels like a hurdle that we're we're getting over. So
Yeah. Well,
yeah.
you're learning a new service, right? Providing a new service, and the patients have to learn what this new
Yeah,
service is and
exactly.
engage with
Both of
it.
us are
So,
learning together.
yes, learning together. Joey and Chelsea, would you like to share some of your challenges?
I would completely agree with Cynthia on the patient buy-in being the hardest part. Living in a rural area, it's mostly and it's a Medicare population, so they're mostly the older people. They're resistant to change. They don't want, they're resistant to technology. They're wary of trusting others. Some people don't really want to um, they don't want to really trust it because what they're doing they think is working fine, or they think that they might have to sign up for an app on their phone, or they're hesitant to do anything because they think that there's more to it. And so trying to get that patient buy-in, trying to get them to trust you, I think that that is definitely like one of the biggest challenges. But like Cynthia said, once they do trust you and once they do realize like you are going to call, that they can call you anytime. Once they really do understand that, it really does change the whole dynamic. And I have people that I call and they don't even say like hello. They just start immediately, going into whatever it is because they know it's me that's calling. So getting that trust is key, and it was very difficult at first.
Thanks for sharing, Chelsea. And I will probably piggyback off that a little bit in the next section about how do you build that trust? Because I think it sounds like that is a challenge. So what are some opportunities and lessons learned that would build that trust up with patients? And is it just time or is there more things that you can do? So, but before I get there, Brandy, what's one of the biggest challenges that y'all have had to go through?
Well, like I've already alluded to, um, who you partner with is important. And so, this was all brand new to us. And so we were immediately intrigued by the big brand name companies, thinking that, it's a big company. They've got a lot of clients. So that, this is going to be our best option. Um, and I just made a few notes because this is very important. So if you're looking at vendors, you want to make sure that one, that you check and make sure that they are not going to outsource any part of the program. I wouldn't have thought to ask that. I thought that I was hiring them, that they were going to be doing the work for me. I would also make sure that no part of this was going to be outsourced out of stateside, that everybody who was working for them is going to be stateside, that they are going to have familiar voices and accents, because we lost a lot of ground with our patients that we had to make up because they were receiving phone calls from somebody that they never heard of, even though their providers had mentioned that they were going to be signed up for a new program. They were like, I've went to this clinic for 20 years. There's not a Stephanie that works there, and there's for sure not a Stephanie with your foreign accent that works there. So they thought that they were being scammed. And so I would just say really get to know your vendors, and we did we called the clients. Of course, they gave us the clients that they knew were going to give them good reviews, apparently. But just make sure that who you are choosing to partner with has the same goals and the same outlook on what they want this program to look like, because we really lost ground and had a lot to make up. We never got over 100 patients with that vendor. And we've been with our new vendor less than a year, and we're approaching 600 clients enrolled in CCM. So your vendor, your partner matters. And so that would be my biggest hurdle, I would say.
Yeah, thank you so much for sharing the lessons
Yeah.
learned on that piece.
Yeah.
I think that is a struggle when we talk across with rural health clinics across the board. There's so many vendors out there you can select from. So trying to weed through and figure out the right partner. and the unique scenarios in rural healthcare. Speed round question before I run on to the next kind of section. Would any of y'all want to share anything that caught you maybe by complete surprise? No?
I'll
Oh,
share quickly.
okay.
I think one thing that caught me completely by surprise was the lack of patient buy-in. I myself thought this was a great idea. Who doesn't want someone checking on them, more often and invested in their health and helping them to, be the best they can be. And so that honestly caught me by surprise that the patients initially were very hesitant to engage in the program.
Thank you, Joey. And let's go into strategies at work and that patient hesitation, because I heard that across different organizations as well. Can you talk about where did you start in identifying patients to enroll them? What worked well? What were keys to success in enrolling patients? And if you can throw in maybe some of your numbers. I heard Brandy went from 100 to 600 in their program, but any numbers out there that you're willing to share with the group today? I'll start with you, Joey. We'll go back to you and Chelsea. Where did you start in selecting patients, and what was key to success for continued engagement?
So in two of the three clinics, they had already tried the CCM RPM programs and were unsuccessful. And so we had a kind of a core group of patients that we started with. One of the clinics, and the clinic that Chelsea is in, had kind of a similar experience as Brandy, where they had lost a lot of trust in the community through this particular vendor. And so just building that trust back was an uphill battle in Anson. And Chelsea's done a tremendous job in doing that. And I think for us, one of the biggest things that's been helpful is having, like Brandy said, a local person that people are familiar with. That, for instance, Chelsea, just seeing her in the community, knowing that she's invested not only in them but in their community and their families and things like that has been a huge help. So we're still, trying to build our numbers. We're just barely coming up on the year mark for this kind of group approach. And so we're still trying to build numbers, still trying to get that patient buy-in. We've had, providers slowly buying in the program too. Not only were the patients kind of discouraged, but so were some of the providers. Just, we tried this before, it didn't work. I don't know if we want to try it again, kind of, mentality, but we've really come a long way. It's interesting to kind of look back in the year and see how far we've come. And I look forward to, the next year and the examples of the other programs and really growing our numbers and our trust in the community.
Thank you. Y'all also engage with the community outside of the clinic walls, right? Can you
I
share some of
really
those
want
strategies?
Chelsea to touch on that. She
Okay.
has been absolutely amazing. She's been, we've just been brainstorming and trying to come up with all kinds of creative ways to just really get that community engagement. So I really would like her to touch on all the exceptional things that she's done.
So yeah, I really feel like I've had success with the community involvement aspect and volunteering. I try to hit all the spots that our community has to offer as far as food pantries, clothing closets, all of those resources, and trying to identify all of the resources that we have so I can create a good relationship with those resources in order to possibly get referrals. But also, I've gone to every single one of those places and seen my patients there, and I'm able to every time I go, I get stopped and I get asked a question, or it's just kind of nice for them to be able to put a face to the name, I guess. And it has, I think it's been beneficial because if I reach out to them to enroll them in care management, they'll say, "Oh, you're the girl that goes to the food pantry." Or if I am local, so if they see me at my kids' baseball game, they'll stop and, talk to me. Kind of just treating people like they're people and showing them that I'm a person, they're a person, and I'm just not another person. They're not a person on a list. I'm a community member as well. That really has made a huge difference, in earning people's trust and making us more successful, I feel like.
Fantastic. Great information, great strategy. And I just saw a question come through, Joe. So just to clarify too that Joey and Chelsea are the ones actively doing care management in their organization. They use a technology partner to provide the platform to do the documentation of CCM and RPM and provide the devices, but they're the care managers. So they're directly employed, as well as Cynthia from Hereford. They're directly employed care managers providing these services. So Cynthia, your approach is really y'all's approach from organization is a care team approach. It sounds like I've heard too how you engage with patients is more direct, maybe when they're coming in for visits or they're coming into your four walls. Do you want to share a little bit how successfully have you been in identifying patients? Where did y'all start with enrollment, and how has that evolved over time?
Uh, when we first started, they had a vendor, a group of people that would make calls outside of this facility. And when they saw that we had about 200 to 215, Kristen and our CEO, Candace, decided, we need to bring it in-house and see if it does better. And so they did, and that's when I started here. And sure enough, it did help. And like I said before, at first they were kind of eerie because they were talking to strangers, people that did not connect with their PCP, and they didn't know their medications, and they really, and a lot of times I would get the response of, I don't know what this is. I've never gotten a call before. And I think just, we get so many spam calls and everything. It probably got lost in the mix. But when they learned that I was here in-house, when they come in for an annual wellness visit, we make a real big effort to go in there and say hi. The PCPs, if there's any question, I tell them, call me. I'm down the hallway, and our clinic is small. When they're in the hospital, uh, we make it a point to go over there and visit them also. I mean, we're really blessed that our hospital and our clinic are connected. So I just walk down a long hallway, and so that to them is really, I mean, I would feel special. I hope they feel special. And so it really helps again to build that trust, and that for them to know that we really are here for you. We really want to help you, and let's do this together.
Great. Thank you for sharing. So yours is, it sounds like more referral based too of how you get patients, or you see that they're coming in for a wellness visit and you're meeting them bedside and then having this conversation of what chronic care management is and then enrolling them.
Mm-hmm. Yeah, and our doctor, our medical director, Dr. Rom, when they're in the hospital, he talks to them about it, or they come in for a visit, and then he'll let us know, hey, go visit with them and see what they think about it. So yeah, he's
Awesome.
always been on board. He's always been a huge supporter.
Those clinical referrals, I'm sure help tremendously.
Mm-hmm.
Brandy, for you all, what has been, you've talked about finding the right partner. Is there any additional pieces that you wanted to add? And what worked well? What's the key to success here and strategies?
Yeah, so it definitely is physician and the nurse buy-in. That's very important after we failed miserably the first time. We just kind of had to put our tail between our legs, and we had to we had a meeting with all the physicians and nurses. We had the new vendor, and we were like, hey guys, like, we're sorry. Like, it did not work the first time. We gave it our best shot, but it didn't work. And we have learned why it didn't work. And we have found somebody who is the exact opposite. And so once they saw that we were willing to admit, sorry, y'all did get a whole lot more phone calls. This was not what it was supposed to be. They responded very well. They were like, let's do this. Like, thank you for being honest. Thank you for realizing that this didn't work. And thank you for doing the footwork and finding a way to make this work, because we do find value in it. And so our myself and then our new vendor, we met with each provider and nurse individually. We individualized the program based on what they wanted, and they became our champions. Instead of having one physician champion, we had seven physician champions. Like, they were gun ho. They knew it took a lot to admit, the failure, and they were willing to partner and really see it grow and expand. And it's been exceptional.
That's fantastic. And so for those that have joined the call too, so Brandy and Limestone, they have outsourced all of RPM CCM, but it sounds like it's very much coordinated with the clinics. And Brandy, curious how you all are identifying patients to enroll in CCM. How does the patient get from not being in the program to getting services from your vendor?
So we run a report for our vendor based on diagnosis codes, and then that is provided to our vendor, and then the vendor looks at it, and then they communicate with the provider and nurses, and they say, "Hey, we identified this patient. Based on their diagnosis codes, they would qualify for this program. Do you feel like this patient would benefit from this?" And then at that point, because it's so important to have that physician oversight, we don't just want to run codes and enroll every single person. That's part of the problem that we've seen in the past. And so letting that physician be actively engaged in that decision process, that is where the physician oversight starts. And it's so important. So, but yes, we're just running a report. They're looking at it. Then they're notifying the physician, and the physician is ultimately making that decision. And then also, I'm also over the inpatient case management. So I'm seeing patients that are leaving the hospital who are maybe establishing care with our providers. And so I'll just send, hey, be on the lookout for this patient. They're supposed to have a follow-up appointment to establish care. I think that this would really be good for them. So a couple different ways, but mainly having that report and then talking to the physicians.
Great. And this has been the stories y'all have shared, how you've gained the patient engagement, how you're getting provider buy-in and staffing buy-in, has been enormous here. It sounds like might be a big feat, but it takes time and you eventually get there. The other piece to this is there's also the coding side. Like, you want it to be a financially sustainable program. Can you speak to about how are you coding? Who's doing the coding? Maybe Brandy, you can start first. Is the vendor actually coding for it, or is it internal teams doing that?
Yes, the vendor codes everything, prepares everything. Everything is bundled up beautifully, and it is released to my billing department. And then they basically we are accountable for what we bill. So it is important that we are overseeing that we are checking that. But our vendor and our billing department, they've become best friends. They work very well together. And ultimately, it's just us doing a quick review, making sure everything is looks correct, and then we just bill it out. It's a very streamlined process.
Great. Joey and Chelsea, how does the coding work from y'all's standpoint?
So our vendor also sends us a report with the coding, and then I do a quick review and send those out to each clinic. And each clinic kind of has their own billing process and an internal billing person that then submits the billing, whether it be some of them is actually the person that's doing the chronic care management also, because like Cynthia said, we all wear multiple hats.
Yeah. And so y'all are doing the care management work, document in the technology vendor, and then out of that technology, you can generate a report that can then be coded.
Correct. Yes.
Awesome. Cynthia, what about for you?
Pretty much the same. Our vendor, Clinny, they develop a report and then we look over it. Julie looks over it and for each individual patient, and then we get it in through billing and go that route.
Okay, fantastic. So thinking about the program, how far it's come along and where you're at today, what are your thoughts around the impact that it's had on your community, on your patients, or even in the clinic? Has there been, more efficiencies created, maybe less phone calls down the line, maybe less visits go from 60 minutes to 15 minutes? What outcomes have you seen? And how do you see the program and its future sustainability? Um, I'll go start with Joey first.
I actually would like to defer to Chelsea because I think she has that firsthand in clinic experience. As far as the importance and sustainability, I think it's going to make a huge impact once people allow us to help them. It will make a huge impact on quality of life for this population and just the compliance in being an active participant in your own health and your own goals, and not just taking a pill from a provider to control your blood pressure, and just being active in your health care and showing people that the importance and giving them that power in their own lives. I think eventually will make a huge impact in especially our rural communities.
Thank you. Chelsea?
Yeah, I think the biggest impact is, like she said, having people to be an active participant in their health, but also having somebody that's an advocate for them. I feel like a lot of our population doesn't have many people to help advocate for them. And so, whether it's holding them accountable for what their instructions were when they were seen, or making sure that they actually made that follow up with their cardiologist that, their doctor told them to make, those sort of things, but also the social aspect of it. I think that that is a big impact. They kind of Some people just wait and they don't they think like, oh, I'm just a bother, or oh, I'm not going to call the nurse again because she's heard from me a million times. Me being that dedicated person that they know that they can call a million times, and it's not gonna, that knowing that that's my job. I think it makes better patient outcomes, and I think that they really appreciate having somebody that they can trust on a medical front, but also a social front that they can kind of air their grievances to, and somebody that they trust. I think that has been very impactful for a lot of my patients.
Thank you. Brandy, would you add any additional pieces from your perspective?
I would just echo what they're saying. I mean, we had a health fair here not too long ago, and I saw a patient talking to somebody about a colonoscopy screening, and they said, "Well, I'll get back to you as soon as I talk to Sarah." And I thought, "Who is Sarah?" Well, it was their chronic care manager. Like they wanted to. I mean, so it's really building that rapport and that trust, and it's been wonderful to see. And then also we are capturing some visits, if the care manager sees that they haven't had their follow-up or they've missed a visit. And it's so beautiful that they're in our EHR because they can just go ahead and get that patient scheduled. So it's saving on phone calls for scheduling. It's saving phone calls for the nursing staff. So it's been good.
Great example. That's awesome to hear. Cynthia, would you add anything from your perspective in terms of outcomes and sustainability?
Yes, a huge impact that I see that we have a really huge Hispanic Spanish population, and and then of course also elderly Medicare, and they're so used to trusting us just to give them a medication for the issue, and I know our providers, they do really good about teaching, but when you're in that setting, and it's not a lot of time for that teaching to go a long ways. And sometimes you have to hear it over and over again. And especially somebody that only speaks Spanish. And so I've seen a huge difference in a lot of my patients, a lot of our patients that before they didn't understand why is it important to take a blood sugar? Why is it important to cut back on salt? And all these simple little things that they do at home. And now they understand, and you see those A1C numbers that are better, and you see the blood pressures that are better, and they understand that that's because of what they did, to take care of themselves. And so that's a really, I enjoy that part of it, to that they feel like I'm getting this, I'm taking care of myself, and I know what I'm doing, and I know why.
That's awesome. And
Mhm.
I'm so glad to hear the impact and positive impact that everyone's experiencing, even whether you're doing it in-house with your own care managers or you're hiring a vendor to do all the work for you, but it's finding the right partner. So thank y'all so much for sharing. I think there's a couple questions in the chat. I know we have about 15 minutes left. I do want to pose this one out there on there's lots of questions around the financial aspect. And to follow up after this webinar, we have another webinar coming up in August that will get deeper into the financial aspect of CCM, RPM, as well as wellness visits. For several of these questions, we'll push those to our August webinar. Feel free to join us then. But one of the things that I've heard is the patient responsibility, especially around the copay. Have y'all experienced a challenge with the patient responsibility?
So for us with our first vendor, we did, but now we really haven't seen that. Of course, if they are just Medicare and they don't have a secondary, then they're going to have responsibility. With the Advantage plans, a lot of those there isn't. But our vendor now, and we've almost been with them. I guess we've been with them for 7 months now, going on 8, and there has been no surprises for our patients. And as a matter of fact, some of the patients who were hesitant to enroll with the new vendor because of bills and stuff from the last vendor, they were actually able to help us get some things recoded. And so those patients in turn signed up after they saw the billing being handled correctly.
That's fantastic. Cynthia, Joey, Chelsea, have y'all had any issues with the copay piece?
I would say so. I try to audit our claims every couple of months to kind of get a feel for what the copays are looking like. Um, Most people don't have a copay. I would say that they range anywhere from $5 to $20 if they do have a copay. I'm always really transparent about the billing process and that, they're not locked into a contract or anything. So if it ever becomes a financial burden, that they need to let me know and we can figure that part out. And I think I've only had two patients in the past 8 months discontinue care management because of the cost. So overall, I would say most people aren't concerned with the cost if they do have one.
That's amazing. I think that's a challenge that several people might go into this thinking that that is going to be a big burden, but it sounds like if you're providing the robust care, chronic care management services that they're intended to receive, they feel like they're getting the value out of it. Um, and is there, I think this is a good piece too, because we talked about number of patients enrolled. Chelsea, you just hinted on how long maybe the patients enrolled in CCM. Can y'all give your perspective on patient enrollment? Are they staying enrolled month after month for 12 years? I mean, for 12 months or 24 months, or is it a 9 month type graduation and they're off CCM? What does that look like? How do you keep the patient enrolled, and at what point do they come off services?
For our clinic specifically, um, we kind of just we keep them on unless there's some sort of reason for them to come off, or if they've met their goals. I would say, we if we enter a maintenance period, then we'll consider it. I try to talk to everybody and see what their opinions are. Going back to the social aspect of it, I have a lot of patients that even if they're well managed, they want to stay on because they would like somebody to kind of run through things with them, kind of like Brandy said, like somebody calling me and say, "Hey, should I actually schedule my mammogram? They're saying I'm due for a mammogram." So I do have quite a few patients that are kind of just on a maintenance program. Um, but if there's any kickback on the insurance where we're having issues with it getting paid, I personally tell my patients like, "Hey, this is what's going on." Or if they get a bill and we say, "Well, maybe we should, pause it and come back to it in a couple of months." And that's kind of how I work it, but I don't know how everyone else.
No, that's great. Thank you, Chelsea, for sharing. And I know we're coming up on time. Um, a quick question to close us out. If I'll start with Cynthia. If another rural health clinic called you tomorrow asking where do you start, what's the first piece of advice you would give them?
Um, it's really important to communicate with the providers. Uh, let them know what the program is about and communicate with them throughout. Anytime that patients have questions or there's any changes, I'm sending them a note, just to so that I can have that support from them, because that's going to be very important for the provider as much as it is for the patient. I'm kind of the middleman. That's how I see us, is we're that another, I always tell them we're another source of communication from you to your provider. And so, always keep that line open, that open communication.
Brandy, what about for you all? What's the first piece of advice you'd give anyone
Yeah,
looking for CCMRPM?
I agree with Cynthia 100%. I feel like identifying who your physician champion's going to be, and then letting that person help you discuss with the other providers on how this program is going to bridge the gap and how it's going to, number one, benefit their patients, but two, it's also going to take some of the burden off of them and their nurses and allow them to spend more time doing other things. So identifying who that physician champion is going to be, that would be my starting point.
Thank you. Joey, same question.
Yep, I agree with everything that's been said. I was going to say, just having a group medical staff meeting maybe with all the providers together to go over any questions or concerns and educate, the providers even on how beneficial this is not only for their patients but for them as well. And that over communication and that I feel like that's kind of where patients kind of get lost is in, we're bridging that gap between the patient and the provider. I think emphasizing that and the benefit that it is to both sides is important.
Great. Chelsea, would you like to add any additional thoughts?
No, I completely agree with everybody on everything. It's the communication that is definitely key.
Well, thank y'all so much for sharing today your experiences with the broader audience here. It sounds like some of the things are, it takes time. You're learning as your patients are learning. You have to help educate patients what the services are, and then making sure you're bringing along your team, your clinic teams with you in this journey so that you're working through the engagement together and communication, whether that's if you're doing it fully in-house or bringing in a vendor. I think that resonates across the board. For chronic care management and remote patient monitoring at Texas A&M Rural and Community Health Institute, we provide CCM and RPM consultative support. And so if you have any other questions, feel free. I put my email in there. Feel free to outreach. I've worked with these ladies in their expertise along this journey. So it's really great to have them here to share their journey, and looking forward to those that might be getting started or might have started and still don't know how to grow yet, or maybe have hit a plateau. We're happy to come in and help support and share the insights like the team has shared today. So thank you so much again, Joey, Chelsea, Brandy, and Cynthia. It was a pleasure having you on.
You.
I'll turn it over to
Thank
Cassidy.
you.
Great, thanks, Rayanne. I just want to extend a sincere thanks to our panelists for sharing their expertise and real-world experiences, and to you, Rayanne, for moderating, and of course to everyone who took the time to join us today. Before you log off, please take a moment to complete the poll that I just launched. It should be up on your screen. That feedback just helps us to continue providing educational opportunities that are relevant. And we also invite you to join us for our final webinar in this 3-part value-based care series on August the 18th. As Rayanne mentioned, that webinar will talk about modeling the financial impact of CCM and RPM. And if you have any questions, Rayanne has dropped her email address in the chat. Please feel free to reach out. And thank you again for joining us today. We hope to see you on August the 18th. Bye, everyone.
Bye.
Bye.